I'd like to bring up our next speaker, Anita Nicely from Put People First PA and the Nonviolent Medicaid Army.
Yay!
Hello, my name is Anita Nicely, and I'm the regional coordinator of Put People First PA in the Southeast and part of the Nonviolent Medicaid Army. We are a statewide, member-led, staff-free organization of the poor and dispossessed, working people coming together to organize for our vision of healthcare as a human right. Since 2012, we have been organizing the millions on or unfairly excluded from Medicaid in urban and rural areas across all the lines used to divide us: race, gender, party, and more. Our organization seeks to answer the Reverend Dr. Martin Luther King's call at the end of his life for a nonviolent army of the poor. Thanks to Ron for inviting us to this event here today. We recognize the devastation that is coming for us. Medicaid is vital for poor and working families, poor and working people. And any attack on Medicaid is an attack on our class. Medicaid cuts equals death. We need to recognize that the attacks to Medicaid today are the result of attacks to Medicaid yesterday. Under our former president, with a bipartisan mandate starting in April 2023, 25 million people in this country were cut from Medicaid in a historically unprecedented purge. 1 in 12 Pennsylvanians lost their health care. Most lost due to clerical error, and half of those who lost their Medicaid were children. Put People First was there, helping people file their appeals to keep their Medicaid, gathering people's stories to share and show that we are not alone in our healthcare crises. We know there will be worse coming as this war on the poor continues. Medicaid cuts equals death, and not just for those directly enrolled. These cuts will harm hospitals, like this one behind me, potentially bankrupting and resulting in the closure of those deemed unprofitable. Put People First PA has been fighting the hospital closures across the state, from the current closure in the Crozier system in Delco, the hospitals in Scranton and Potter County, as well as the closures of Hahnemann in Philly and St. Joe's in Lancaster. These hospitals were vital to us, but not profitable to their owners. Hospital closures are a loss to the whole community and will only get worse as Medicaid is attacked. What will your communities look like without a working hospital? This is why we say Medicaid cuts equals death. That ought to make you angry, that our system is set up that we can lose our hospitals, our health care, and our lives with little recourse. The Reverend Dr. King said, "The dispossessed of this nation live in a cruelly unjust society. They must organize a revolution against the injustice, not against the lives of the persons who are their fellow citizens, but against the structures through which the society is refusing to take the means which have been called for and which are at hand to lift the load of poverty." There are millions of poor people in this country who have little or nothing to lose. And if they can be helped to take action together, they will do so with a freedom and a power that will be a new and unsettling force in our complacent national life. There are now 140 million poor people in this country, 800 dying of poverty every day. If you can recognize that Medicaid cuts equals death, you can recognize that we must organize. The time is at hand for us, the everyday poor and dispossessed people of this nation, to build this new and unsettling force.